welcome back to another PCBH Corner. I'm joined again by Dr. Beachy. I'm Dr. Bauman. So one of the things that came up in our discussion in some previous videos was this idea of metrics and the importance of them. Now, the one thing, whenever I feel like we consult, or if we're talking to just BHCs in general, I feel like...
Or PCPs.
Or PCP. Oh, that's a really good point. That's a really good point. Whenever we use the term metrics or productivities, literally you can almost not only see but hear people's eyes rolling, like just how drastic it is that people just tune out. So the one
I don't know if they did tune out. People can get very visceral reactions.
They get defensive.
Yeah.
Almost. Yeah. That's actually a really good point.
It can be anger and lots of other emotions can show up.
We'll qualify it as not a good response by most people. So the one thing that I feel like you have done an unbelievable job, and I feel like just very privileged that I'm part of the organization that you oversee, is this idea of like making metrics fun and going over them monthly. Would you be willing to talk a little bit about, one, maybe the different ways that you make them fun, and even what your thought process was, like why to do this? Like why is this important?
Yeah, I think that the way you described it in the beginning is how most of us might react or used to react about metrics. It was kind of something that maybe a way of criticizing or coming in and showing how you're not valuable.
And at times, it's probably been used that way. Right?
Oh, for sure.
Right.
So you can understand the association that any medical provider, BHC provider, you could understand why they don't have necessarily a positive association with the terms metrics or productivity. Because, their brains just go to justification of my job and my worth.
Interesting, right?
But I think that we need to own that. Because if it is a justification of your job and your worth, and we all know as a BHC and medical providers how hard we work. So it kind of started with, I wanted the hard work to be captured. Not to put anything on blast, but when we first started in our organization, a lot of people were getting metrics, and I actually asked to be a part of it. And they're like, oh, no, you're doing a great job. We're so happy with BHC.
If you ever hear that, don't accept it.
Don't fall for it.
Yeah.
Don't fall for it. And then I started, at first I was kind of really, relieved or whatever, thinking about like, oh, okay, they're so happy with us. Okay, great. Then you start thinking, but I know I'm working my butt off. And I know that people are getting better and people are getting served and there's access and there's all these wonderful things happening. I want to know where I'm at. So really, at a basic level, we can get all into the details. I feel like when it comes to metrics and productivity, is you just want to know where you're at so that you can make sure that you serve people in your clinic and your community the best that you can.
So it's interesting the way, and sorry for interrupting, but it's interesting the way that you just described that while in the past maybe people have used metrics in a punitive way, and definitely not a productive way, the way you're saying it is actually, this represents a value almost that
Correct.
We're seeing in our community, that we're getting out there, and this is a way of us actually demonstrating that. That's interesting.
I would say in the beginning, it was kind of like, man, I know I'm working really hard. And then it kind of evolved into more of like, as I was saying, I want to know where I'm at with things. And then if I know where I'm at, then you can kind of see where you can get better. And that comes back to what we've talked about in some of the other videos of, if you are having a high productivity level, at a certain point, you might want to be able to advocate for another BHC. So long story short, I think that we know with the way our minds work and the human error that we can have, we want to have an accurate number. We want to know where we stand. And so that ultimately, again, we can get better with the whole entire goal of better serving patients, our organization, in the community.
I want to hear more about the specific ways you go about that. My mind's first question, though, was it easy? I mean, was it easy getting the metrics? Was it easy? Because I think this is a big thing that, people almost, I think the first thing that people think of if they buy after they get through the initial shock metrics is, that sounds great. Like, how do I do it? Like, how do I get those metrics?
I think it's a lot of advocating. You got to figure out if there's a mechanism already in place in your organization, maybe for the medical providers where they're doing it, going to that source and just seeing, can they cross it over to yours? And then you're going to want to look at it and see where is that data being pulled from, so that it makes sure that it's accurate.
Ooh.
So behind the scenes, we had to do a lot. There was a lot of steps. There was a lot of meeting with different IT folk, analytics folk, applications to get the right combination to where you can get accurate data. It still isn't perfect, but we're really, really close. And you just have to stay on it and watch as iteration to iteration in order to get the metrics that are correct.
Can you talk about the clubs that you have the organization do for related to metrics?
Yeah, I can't even honestly remember how it completely came to fruition, but I think
it was a variety of just team members and coming up with different ideas, and yeah.
At a certain point, I realized like metrics aren't going away. We know that they're valuable to be able to advocate. And we also know they're valuable for for yourselves as core BHCs and for trainees to figure out, again, as we were saying before, where somebody's at and what we can improve upon. So we already knew that at baseline. So we're going to be going over them, right? So why not make it a little bit more fun and strength-based? So just kind of started to think through, all right, we're going to have the marathon award. So that's going to be the person who's in clinic the most, because they're going to be the
hard thing.
Yeah, they're on the front line. They're boots on the ground, and they're holding down the fort oftentimes, so other folks can do different roles. Maybe it's a teaching role. Again, not saying that that's not difficult, but there's something to being in clinic a lot. So we had the marathon award for the person who worked the most clinics. Then there's the producer award. So the person who's going to come has the most visits in a month. And then if you get over 100 visits in the month, which is a really, that's a really good place to get to, it's the Benjamin Club.
Huh.
Yeah. And
cool.
So then, you start adding from there and different ideas come up. We have a Culture Shaper award that we give out once every 3 months, where the team votes on somebody who's impacting the culture of the clinic. And then they say what it is that person did, and people vote on it. We have a Shining Star award where somebody has the highest patient satisfaction. Also, once again, done on a quarterly basis. We have BHC Quotient, BHC of the Month award. So that's kind of taking... we can get more into the details of it, but essentially somebody who's getting a high percentage of warm handoff initial visits, as well as high productivity, making an equation, and then having it come out to be the BHC of the month.
What's really interesting about what you just said is, if we go back to like the first video when we started talking about metrics, was how metrics are usually done in a punitive manner. That you get handed like your sheet of productivity and say like, you're not meeting productivity, what are you going to do? What you're talking about really does reflect that idea of like a strength-based approach, that these are the things that we really want to acknowledge and really want to reinforce. So taking like almost a behaviorist approach, that we're going to bring attention to the things we want to grow.
Sometimes it's nuanced, because sometimes somebody's working a lot of clinics and seeing a lot of patients, but if you look at the average visits per clinic, it might be just a little bit lower than what they're used to. And somebody can look at that in a negative way. Or sometimes I look at that and I'm like, dang, they were holding down the fort.
You were in a lot of clinics.
For the whole month.
Yeah.
And that's great. And so, we also have the New Heights Award, which does look at the average visits per clinic, the highest average visits per clinic. And that's great. But if we can go and make more of a balanced view of, again, who's getting 100 visits? The other one that I forgot to add was... the sharpshooter. So if you're hitting the average visits per clinic, you get added into the sharpshooter club. And then we have a warm handoff award. So it's the All-State Award, All-State Club Award. So if you get 1.5 warm handoffs, you get in the club. And then if you have the highest warm handoffs, I can't remember what that one's called.
All-State Award.
The All-State Award.
Yeah.
I just think it takes a nuanced approach to give everybody credit for what everybody's different role might be and how it might play out, from the folks that are holding down the fort and working a lot of clinics to the folks that maybe have less time in clinic, but they're having a very high visits per clinic, so they're very efficient, and folks that are impacting the culture and having high patient satisfaction. I think that we really want to find a way to highlight everybody's strength and appreciate the role that they might have on the team.
Yeah, and again, that makes metrics fun and a good thing to review.
Yeah, the last meeting, reading them out instead of showing it on the board.
I know. People were hyped.
It was like an awards show.
Oh, for sure.
We're like, the next up for the New Heights Award.
Yeah.
And then got to say it, and then everybody in the meeting is like clapping, and it was awesome.
Well, it's funny. I know we've had this conversation before about how if we're like close to a certain thing like handoffs or for close. It really is amazing about how self-monitoring does really like affect your behavior.
Oh, and how your own reward system.
Oh.
Because I created the Benjamin Club at the 100.
Yeah.
You should have seen me. I didn't realize I was at 96 until I didn't properly pay attention. I was at 96 towards the end of the month. I almost literally put myself back into another clinic just to get the Benjamin Club that I made up.
Yeah.
So, hey, behaviorism works.
It does work.